My name is Tiffany Adams. I'm a nurse practitioner student at Auburn University. I'm currently an RN, and today I'm going to perform an initial head-to-toe assessment. This is Chance. He's a 33-year-old well-nourished male. I assessed his gait as we were walking into the exam area today. I also assessed his orientation. He is oriented. His dress is appropriate for the weather and for the examination today. He's well groomed. Nails are clipped. His mood is calm and appropriate. His posture is upright. So when we came in, I performed hand hygiene, and then I took his vital signs. His blood pressure was 120/80. His pulse was 74. Respirations were 16. Oxygen saturation was 99% on room air, and his temperature was 98.2 orally. Also assessed his height and weight. So now we're going to get started with our exam. Okay, any questions before we start?
No.
Okay, all right, so we're going to start with your head. I'm just going to visualize your head, inspect. There's no skin abnormalities. Everything's symmetrical. So now I'm going to palpate your head. Do you have any tenderness?
No.
Okay. There's no lumps, no lesions, no indurations. Hair is coarse and thick. Okay, so now we're going to move on to your face. Okay, so I'm going to inspect your face. Face is symmetrical. No skin abnormalities there. Excuse me. Now I'm going to palpate your sinuses. Okay, this is the mandibular and the frontal. You can also transilluminate, but we won't for purposes of this exam. Did you have any tenderness there? Okay. So I'm going to palpate your temporomandibular joint. Open your mouth for me. Close. Side to side. No popping or clicking. Any tenderness?
No.
Okay, so that, and clench your jaws for me. All right, that assesses cranial nerve 5. So now we're going to assess cranial nerve 7. So if you could blink for me, lift your eyebrows, smile, frown, puff your cheeks out. Okay, that cranial nerve is intact as well. Okay, and now I'm going to palpate his lymph nodes. So we have preauricular, postauricular, occipital, tonsillar, submandibular, submental, cervical, and supraclavicular. There's no lymph nodes that are palpable, no nodules palpable, so that would be a normal finding for, for the exam. All right, so now we are going to look at your eyes. First, I will just look at his eyebrows and eyelashes. Hair distribution is even. Hair is growing appropriately in the right direction on eyebrows and eyelashes. There's no redness on his eyelids. His eyes are midline and appropriately placed on his face. No deviations there. There's no scaling to his eyebrows. All right, so normally to assess cranial nerve 2, we would use the Snellen chart. In this case, because we're space limited, we'll not be doing that, but a normal test, you would cover one eye, read the smallest line first, and then do the other side. A normal finding would be 20/20 vision bilaterally. So now we will test confrontation. So if you can cover one eye for me. All right, just look straight ahead and tell me when you can see my finger. Okay, that's intact. Now we're going to do the cover-uncover test. Look straight ahead. Straight ahead. Okay, no deviation there. So now we're going to check the 6 fields of gaze. You just look straight ahead. Don't move your head. Just follow my hand with your eyes, okay? that's intact. So now I'm going to check his corneal reflexes, corneal light reflexes. If you could cover that eye for me. Okay, other eye. Okay, pupils are equal, round, and reactive to light and accommodation. So now we're going to do the whisper test. This checks, these three tests, ear tests check for cranial nerve 8, which is the acoustic nerve. Okay, if you would, I'm going to whisper a series of letters and numbers. If you'll cover your other ear, you do this 2 feet behind the patient. Okay, can you tell me what you heard?
1CW.
Okay, perfect. All right, and now we're going to do the Weber test. Tell me where you can hear that.
Both sides.
Okay. And now we're going to do the Rhine test. Tell me when you can't hear it.
Okay.
When you can't hear it.
Okay.
Okay. Air conduction is greater than bone conduction, which is a normal finding, and that's what we expect to see with that test. So that test, let's see here. Okay, now we're going to move on to the ears. So I'm going to inspect the pinna, the auricle, and the canal externally, and then I'll palpate. Any tenderness?
No.
No? Okay. Okay, and now I'm going to look in the middle ear. So you pull the pinna up and back. There is a mild amount of cerumen. It's light yellow. There's no fluid, no redness, no lesions. The malleus is visible. Tympanic membrane is pearly gray and semi-transparent. And no foreign objects. Alrighty. Now we're going to move on to the nose. So I'm just going to inspect his nose. It's symmetrical. There's no skin abnormalities on the nose. I'm going to palpate. Any tenderness?
No.
There's bone in the upper 1/3 of the nose and cartilage in the lower 2/3. Okay. So now, I'm going to get you to lean your head back just a little bit. I'm going to look in the nose. Okay. Mucosa is pink and moist. Turbinates are patent. And there's no septal deviation or herniation. All right. If you would close your eyes and cover your right ear. I'm going to put this in front of you and tell me what you smell.
Alcohol.
Okay. So his olfactory nerve, which is cranial nerve 1, is intact. So now we're going to move to the mouth and throat. So his lip margins are intact. There's no cracking, no lesions, no ulcerations on the lips themselves. So I'm going to look inside your mouth. Open up wide for me. Palate is intact. Dentition is intact. No dental caries present. No missing teeth. Posterior pharynx has no exudate. Stick your tongue out a little bit better for me. Okay. Uvula is pink and midline. Gums are well approximated. No redness. Buccal mucosa is pink and intact with no lesions. Tongue is pink and moist with rough texturing. And underneath the tongue, there are no nodules or ulcerations present. Skin is intact. Okay. Thank you. All right. If you could open up for me, stick your tongue out. Say ah. Okay. This is also normally where we would check the gag reflex, but we won't do that for purposes of this exam. Also, can you stick your tongue out and move it side to side? Okay. And can you swallow? Okay. Awesome. And that checks cranial nerves 9, 10, and 12. Okay, so now we're going to inspect the neck. So neck is symmetrical, no skin abnormalities present. Can you swallow for me? Okay, trachea is midline, no deviation, no nodules present. Can you sit up just a little for me? That's good. Okay, swallow for me. Thyroid is movable, no nodules present, midline. No, any tenderness?
No.
Okay. Alrighty, let's see. Now also, while we're doing that, shrug your shoulders for me. Okay. Push against my hand. Push against my hand. Okay. Can you move your neck side to side, front to back, and rotate around? Okay. And the shrugging and the head against resistance checks cranial nerve 11, which is the spinal accessory nerve. All right. So now we're going to move on to the chest. We'll do the posterior chest first. If you could just sit up for me. All right, perfect. So I'm going to inspect the chest first. You want to inspect the skin for any skin abnormalities. You want to watch the chest expansion for an even rate and rhythm. You can also check your rate at this point. Then you want to palpate at the 10th rib. Take a deep breath for me. Okay. For even chest expansion, no tenderness.
No.
And then you want to palpate at rib 12 for CVA tenderness. Any tenderness?
No.
Okay. All right. So now I'm going to auscultate all the lung fields. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Deep breath. Okay. And note that you would like to do that in a ladder-like pattern when auscultating. No adventitious breath sounds are present. Lungs are clear and equal bilaterally. So now I'm going to percuss each lung field. Okay, a percussion is resonant over each lung field, which is a normal finding. Now I'm going to assess for tactile fremitus. If you would say 99.
99.
Again.
99.
Again.
99.
One more.
99.
Fremitus is equal, no crepitus is felt. Okay, if you would just lean back for me. Okay, so now we're going to do the same thing with the chest. We're going to inspect the chest and look for any skin abnormalities. No abnormalities are found. Hair distribution is even. Chest expansion is even. There are no accessory muscles being used. So now I'm going to auscultate breath sounds. Deep breath. Deep breath. Deep breath. Deep breath. All right. So now at this point, I'm also going to check here under the 10th rib. Take a deep breath. Okay. For even chest wall expansion, and it is even. So I'm also going to percuss the front. Sounds are resonant over the lungs. Now I'm going to assess for tactile fremitus. 99.
99.
99.
99. 99. 99.
Okay. Fremitus is even. There's no crepitus heard. So now we're going to move on to the cardiovascular portion of the exam. So the first thing I would do is just assess, inspect, and look for pulsations. Don't see any visible, which is normal. You don't want to be able to see any visible. So then I would palpate the chest for any tenderness. Any tenderness? Okay. And then you want to palpate all the different areas that you would auscultate as well. So you'll palpate aortic, pulmonic, Erb's point, tricuspid, mitral, and apical point. You would also have the patient turn on their left side and feel for the apical point to see if you could feel a pulsation, which you're not supposed to be able to. So not hearing one or feeling one is a normal finding. Okay, so then you want to auscultate. So for auscultation, we're only going to use the diaphragm, but in a normal exam, you would use the diaphragm and the bell to auscultate each area. Just breathe normal. Okay, you can hear S1 and S2 in each area. There's no abnormal sounds, so that would be an abnormal exam. And you would also use your bell to check the other side. So now we're going to assess JVD. So normally the patient would be at 30 degrees. Tilt your head back just a little so I can show them. Okay, so we would check the carotid pulse and the temporal, but you never want to do both at the same time. So you would palpate the pulse. No bruits present. No bruits present. I'm going to palpate. I'm going to listen. Okay, you want to listen there. Alrighty, so now we're going to move on to the abdominal portion of the exam. If you would, lay flat for me. Alrighty, so the first thing you would want to do, and normally the patient would be in a gown, so we did not do the gown in this exam for modesty purposes, but normally they would, so you would assess the skin. You would look for any stria, you would look for any wounds, any ulcers, lesions, abnormal skin discolorations, bruising. The umbilicus is midline. So then you would auscultate the 4 quadrants with your diaphragm. Okay, and you would use your bell to auscultate the epigastric area, to listen for the aorta. Okay, and all 4 quadrants, the vowel sounds are normoactive. Okay, so now you're going to percuss each quadrant. At this point, you would also want to percuss the liver and the spleen. You should feel dullness over the liver and the spleen. Also, the liver expansion is 7 centimeters. So now you're going to do light palpation. Any tenderness?
No.
Okay, no masses, bulges felt there. So now we're going to do deep palpation. And also palpate over the epigastric area. And we would also palpate deep palpation here for the liver and the right kidney, and the left kidney and the spleen, which you don't want to be able to feel. So not being able to palpate those is a normal finding. Alrighty, so now we're going to move on to the breast. So males do breast exams as well. So if you will, lift this arm above your head. So we would start on the outer portion of the breast and work our way in. You want to pay attention to the subareolar, areolar, and nipple area. You also want to palpate the axillary nose and look for any discharge, any nipple retraction. Do you have any tenderness here? And you also want to teach the patient that when they're performing a self-breast exam, that they want to do that in two different positions. So arm overhead, arms by side would be an appropriate way to do that. All right. And also you want to palpate the tail of Spence here in this area. Okay, so now we're actually going to move on to the musculoskeletal portion. So we'll do the first part laying down. We're going to start with his hips. We would inspect his hips first for symmetry. Then we would palpate. Do you have any tenderness? Okay. We would also be able to palpate the inguinal nodes, the femoral artery, and the iliac artery at this portion of the exam. No bruise found in the arteries is a normal finding. So if you don't mind, lift your leg up in the air for me. Down. Cross your leg over your other leg. Okay. Can you bring it out to your side? Perfect. Okay. So he has full range of motion in his hip. So now we're going to move on to the knee. So I'm going to palpate, or inspect first. No redness, no swelling. And then I would palpate for any warmth. Is that tender? Okay. Can you bend your leg up for me? Perfect. All right. Straighten back out. Now we're going to move on to the ankle. If you can, flex your ankle back, forward. Okay. Side to side and rotate. I'm also going to check the popliteal pulse when I do the knee portion of the exam. With the feet, I would check dorsalis pedis, posterior tibial, and then also check capillary refill, which needs to be less than 3 seconds. Okay, pull against my hand, push. Okay, strength is 5 out of 5, muscle strength for that. Okay, so now we're going to have you stand, and we're going to do the upper body portion. So I'm going to trade places with you so everybody can see you. Okay, so first we're going to check the shoulders. So I would inspect the shoulders to make sure they're symmetrical. They are. No skin abnormalities present. So if you can push against me, shrug. Okay, 5 out of 5 strength there. Lift your arms up over your head. Okay, come down behind your back. Okay, and bend your arms across your arms. Okay, so he has full range of motion with his shoulders. So now we're going to check his elbow. If you can, bend it. Okay, and twist. Okay, full range of motion and no crepitus in the elbow. We're going to check your wrist, up and down, side to side, circular motion. Okay, full range of motion in the wrist. If you can stick your fingers out, don't let me close, don't let me pull. Okay, push, pull. Okay, he has 5 out of 5 muscle strength in the fingers, hands, and arms. And now we're going to check his reflexes. Alrighty. You can just stand right there. So we'll check his brachial, his bicep, tricep, brachial. Then we're going to do the patellar. Yeah. Okay. Okay, then we'll check the Achilles and the Babinski. Okay, that works. Okay, so now we're in the neuro portion of our exam. So we're going to check a couple things here. One would be gravesthesia, which is when I'm going to have you close your eyes and I'm going to write something in your hand with my finger and have you identify it. Okay?
8.
Correct?
8.
Correct. Okay, now we're going to check stereogenesis. So I'm going to place an object in your hand and have you tell me what it is without looking at it, okay? Okay.
Quarter.
Okay. Let's do the other hand.
Screw.
Okay. All right. Let me sit my stuff down. Okay. Now we're going to check point localization and also his ability to identify sharp and dull objects. So I'm going to touch you with something that's either sharp or dull. Tell me if it's sharp or dull and where it is, okay?
Sharp.
Okay.
Sharp.
Okay.
Dull.
Okay.
Dull.
Okay. Perfect. Okay. All right, close your eyes for me. And I'm going to touch bilaterally a part of your body. I want you to tell me where I'm touching.
Cheek.
Okay? And that is bilateralization. So if you can stand for me. All right, I'm going to have you stand on one foot. Okay? Perfect. And that's the Romberg test. You can have a seat. And like I said, we assessed Gate when he came into the office today. So his orientation has already been assessed. He's been able to answer questions about the date, year, who the president is, what day of the week it is. So he's completely alert and oriented. As I mentioned previously, in a normal exam, all of these things would be done bilaterally, or many of the tests would, but in this case, for the sake of time, we only did one side on some of those. So thank you for your time.